especially as they're coming up from that lying down position. So you just want to think about observing them as they're getting up from lying down. And so if they're lying down, they might say that they're not as comfortable lying on their back, and they're more comfortable when they're this way. But when you ask them to get up, they roll onto their side, and they have to kind of push up, and they're maybe like, oh, that hurts in their thoracolumbar junction. So that's really where they're feeling that increased pain. And what do we associate with Amoss sign? Ankylosing spondylitis. So ankylosing spondylitis could also be vertebral disc syndrome, and also someone who has a strain sprain of the lumbars will also may exhibit an Amoss sign due to that pain trying to get up. And then how about minor sign? Minor sign, they're going to be starting out seated, and so someone's seated and they're going to do one of those kind of dipping a little, that tendency like, gotta get up, and they're like maybe holding their back, and they're kind of getting up in stages, so that's the minor sign. It doesn't really tell you what they have specifically, so it says they have some kind of low back problem. If you notice that they're only pushing up onto one leg, so maybe one leg's not supporting weight and they're kind of pushing up on one other leg, that's more suggestive of sciatica because they have that one leg that's really symptomatic. But it could be anything going on with the lumbar, so it could be sciatica, it could be lumbar strain, it could be just flare-up of DJD, or other types of arthritis, Facet syndrome, anything that's causing their low back to just feel painful. And I didn't put Gowers up here because none of us have muscular dystrophy, so we're not going to see that here, but it's a specific one for muscular dystrophy, so that's when they're going to be walking up their legs from muscular dystrophy. Proximal muscle weakness. Yeah, exactly. So as they get progressively weaker and weaker, they may need actual supports to get up on, so they may start using crutches or something like that to try to get up. All right, so those are our patient expressing signs. So let's take just a couple minutes to kind of talk through and work through Amoss and minor sign, and then we'll do our straight leg raising and variant.